Hello everyone, this is the Health Matters program produced by the Ministry of Health. I'm Alicia Martin. Today we're talking about two different cancers, cervical cancer and childhood cancer. Joining me in studio is Dr. Shivanie Samlall and Dr. Kandecy Archer-Austin. Welcome to the program, Dr. Samlall.
Thanks for having me.
Today we'll be talking about cervical cancer, and I know that the Ministry of Health has been working tirelessly to ensure that, we encourage women to get screened early for cervical cancer. We know a lot of women are now asking questions about this type of cancer. For those women who are sitting, watching the program, those who are listening, tell us, what is cervical cancer and how long does it take to develop?
So cervical cancer is cancer to the mouth of the womb. Mm-hmm. It's that part of the cervix that we generally check when women are in labor.
What are some of the symptoms of this type of cancer? How long does this cancer take to develop in a woman?
So the cancer can take from a short period to a long period, as long as maybe 10 years. But if persons are immunocompromised, meaning if persons have HIV that are not immunosuppressed, or if persons have any, like a kidney transplant and need to be on immunotherapy, or have any other condition that is affecting their immune system, then that cancer can progress very, very quickly. So they will take a shorter time to develop cancer.
Okay. What about genetics? How does genetics contribute to somebody developing this cancer? I would have grown up hearing persons say, oh, my auntie had it, or oh, a cousin of us had it. So does genetic has a thing to do with the development of this cancer in anyone?
Generally, genetics has no part to play in the development of cervical cancer. And I think our viewers need to understand that.
Yes.
It's generally caused by the HPV virus. The HPV virus being one of the most common sexually transmitted virus. That means about 80% of the population, once they're sexually active, will come in contact or be diagnosed with this virus at some point in time in their lives. So very common virus. So that means that anyone is at risk of getting cervical cancer.
Okay, you said HPV virus. What is HPV for those persons who are listening and viewing and probably don't know what this is?
So HPV is basically a virus called human papillomavirus. That's basically it. It's a sexually transmitted virus as well. And we generally hear words like gonorrhea, chlamydia, HIV. What we don't hear very common is HPV. And I think with us talking more about cervical cancer and there are more awareness,
yes.
Persons are beginning to learn about HPV. But honestly, that was something that wasn't quite established in the past, and persons had no knowledge of what HPV was in the past. But with HPV testing now, persons are not learning as we go about HPV and,
yes.
and what it is.
What do women need to know about cervical cancer? There have been so many misconceptions out there, but tell us, what do they need to know?
What people need to know is that, one, as I would have said, we are all at risk of having HPV. So anyone is at risk of having cervical cancer. We also need to understand that it's a very, very common disease. In Guyana, it is the third leading cause of cancer overall in both male and female. And it is the second leading cause of cancer in women. So very common disease. What we also need to know that, as you would have asked, it's not genetics. Genetics has no
yes.
part to play. And a lot of persons have associated this type of cancer with other things when we talk about vaccines and so forth, So lots of misconceptions out there, and I guess maybe later on we can touch about the vaccines.
Yes. Many women are a bit hesitant when it comes to screening. Why do you think that is?
So I think it's a combination of reasons. Earlier we would have had a conversation whereby one of our staff would have asked a group of women, and those persons cited several factors. One of it is fear. And I think fear comes from different aspects. Fear of being diagnosed with a cancer, fear of the actual procedure in itself, because a lot of persons, I mean, it's an intimate area, right? And so you have to expose yourself to a provider that you might, if not, be comfortable with, somebody you're not familiar with, and you have to trust that person.
Correct.
To do your exam, and which is very quick and generally a bit uncomfortable. But there's so many misconceptions about the testing, like the different tests that you use, that it's painful and so forth, which is generally not the case. So a lot of reasons. Additionally, persons might be fearful of the fact that the money involved if they're diagnosed with cancer, the burden that comes with that cancer diagnosis, the money that they might need to find for cancer treatment as well, the burden of knowing that it's a HPV related disease, and HPV is related to a sexual practice, sexual intercourse. And so there may be stigma associated to that as well. We all have busy schedules as well, and sometimes as a working, even as a working mom, you're committed between work and your family, and then finding that time as well to be able to get that test done. That's also a reason why persons are, not getting the test done.
We hear so much about the screening aspect, and I still believe that, women are hesitant in that area. And to be honest, I would have gotten screened, and it was just simple, a little discomfort, but nothing to talk about really. What can women expect when they show up to a health facility to get screened?
And I'm so glad that you mentioned you got screened, because a lot of times, persons we would talk about things, and then person want to know, well, did you ever get screened? Did you know what it felt like? And yes, I've been screened multiple times, and I'm scared of the speculum generally. But once you're able to relax during that procedure, it's generally quick, and it's over. It's about relaxing, of course, and it's very quick. In a few minutes, the procedure is finished. So what I want our viewers to understand is that there's no need to fear the procedure. It's just the idea of, the importance of getting this done, of preventing a possible cancer and what that means. The entire psychological, emotional aspect that comes with a cancer diagnosis. So you have a few minutes of a procedure versus, that risk of being diagnosed with the cancer.
Yes.
So you have to weigh which one you're going to choose.
Indeed. So you get screened, and then you receive your results. When you do get that result, if you have a negative result, what happens then? What if you have a positive result? What do we do then?
So negative result, it depends on which tests you used. So if you, for example, use a pap smear, then the screening, the recommendation, if that result is negative, is for you to be screened every 3 years. If you use the HPV test, then if you have a negative result, then the follow-up generally is every 5 years. Some providers might ask for you to do what you call a co-testing, which is doing both the HPV and the pap smear together, and the recommendation generally is every 5 years as well. Across the country, we have VIA that we use as well. And so with the VIA, generally that is also every 3 years. Now, there are people who might deviate from that normal screening. For example, we spoke about HIV being one of those risk factors whereby cancer can progress quickly. So those persons are going to deviate from the normal screening guidelines. And so they will be required to screen almost every year.
Okay, thank you, Dr. Samlall.
Hi, everyone. My name is Dr. Shivanie Samlall, and I am an obstetrician-gynecologist at the Georgetown Public Hospital. Too many of our women are dying from cervical cancer. This is sad since it's a disease that is 100% preventable through vaccination and screening. one of the methods of screening that is currently available is a pap smear. This is a test in which cells of the cervix and vagina is collected, placed on a slide, and sent to the lab for testing. A result may either be negative or abnormal. A negative test will result in a follow-up in 3 years. However, an abnormal test, the follow-up will vary. Again, no woman should die from cervical cancer. Women, come out and get screened today.
Mother, wife, sister, daughter, friend. Women play indispensable roles, shaping the very fabric of our society. But amidst their strength, a silent threat lurks in the shadows: cervical cancer. It's an abnormal growth of cells that starts in the cervix, mainly caused by the human papillomavirus. Each year, this disease claims the lives of hundreds of thousands of women worldwide. But it doesn't have to be this way. Cervical cancer is highly preventable with regular screenings and the HPV vaccine. And when caught early, it's treatable. Women, you are the heart of the world. So let's start talking about cervical health with healthcare providers. Encourage one another to get regular screenings and HPV vaccinations, and adopt healthy lifestyle choices.
Your presence, your voice, and your contributions are invaluable.
Schedule your screening today. Together, we can end cervical cancer.
A message from the Ministry of Health.
Now, if the test is positive, I would like for our population to know that it doesn't mean that you have cancer. It would mean that, that you're at a higher risk of developing cervical cancer, and that would also warrant more frequent screening or testing. And depending on that results, maybe that result might come back as abnormal, and then when you do further testing, you might have a cancer diagnosis. But not all abnormal tests means that you have cervical cancer.
Okay. What about the signs and symptoms? What can women look for when they think about cervical cancer? What are some of the signs and symptoms that they should look out for?
So that's where, before I go into the signs and symptoms, what I would like our viewers to understand as well is that the signs and symptoms generally present late. And so, as you would have related that you've interviewed someone who had cervical cancer, and when she was diagnosed, when she presented with symptoms, she was already stage 4 disease. And that's the reason why screening is so important, right? It's important that you do the screening. And the reason for that is that you can be able to pick up abnormal changes to the cervix long before they develop cervical cancer. Now, the signs and symptoms can vary. Generally, a lot of patients will come in with abnormal discharge. They would, refer that they have watery discharge, and sometimes this gets mistreated as a vaginal infection. So it's very important that if you think you're being treated for a vaginal infection repeatedly, that you get a second opinion, or you do your routine screening for cervical cancer. Abnormal bleeding can happen. So patients can have heavy bleeding between their menstruation, or even bleeding after sexual intercourse. And this is very, like when you hear these things or you notice these things, that generally should trigger you to seek medical attention very urgently. Some patients can have persistent pelvic pain as well. So pain to the abdomen, the lower abdomen, that is there all the time and it's not getting better. And, you might be treated for this at some point in time, but if it's persisting, definitely get your test done. There are other vague symptoms, but those are the most common ones.
Okay. What role does the HPV vaccine play in preventing cervical cancer in persons?
A big role. A big role. There are multiple studies that are done that show the effectiveness of these vaccines. Like, for example, Australia is right on its way to eliminate cervical cancer, and a big part of that country's accomplishment has been the rollout of the HPV vaccines with a good screening program that they have. So HPV are, are very play a big role in terms of eliminating cervical cancer. And they also protect against other HPV-related diseases. You have cancers from HPV that can involve your throat, your mouth, your throat, your anogenital area, your penile area, and other causes, vulvar cancer, vaginal cancer. So it also prevents those other types of cancer that affects both sexes, as well as genital warts. And that's very, very common. And the morbidity that's associated with that is enormous. Now in Guyana, we have the Gardasil vaccine.
Yes.
And the Gardasil 9, which was started earlier last year. And, back in time, that was a hard vaccine to get access to once you're beyond the age of 15. You couldn't get access to that vaccine, but it's accessible across the country at most health centers or even at Ministry of Health. And, anyone from the ages of 9 to 45 can access that vaccine.
Something that gynae should definitely take advantage of, to be honest.
Definitely. I can remember going all the way to Canada 10 years ago or probably 8 years ago to just get this vaccine. So, and we have that accessible. And if you go to most countries, you have to pay an enormous cost, almost $200 US for this vaccine. And we have it here in Guyana, and it's free of cost.
Thank you so much, Dr. Samlall. Well, before we wrap up today's or this aspect of our program today, do you have any final words of encouragement for our listening and viewing audience?
I would say that, the Ministry of Health is doing such a wonderful job right now in terms of reaching our WHO's target of eliminating cervical cancer through the HPV voucher system. That is accessible to the population. That program that they would have introduced, that's played a huge role. I think the minister had quoted 12,000 persons who were screened in 2024, and that's enormous. That's 12,000 persons that, that we know that by just screening, we're going to reduce their risk of developing cervical cancer. So there's a big role that Ministry of Health has played.
Yes.
And now with the introduction and the availability of the HPV vaccines across the country, so I think you should be able to access your screening and get your HPV vaccines. I think that's something that I want our viewers to take away home today.
Thank you so much for joining me on the program today, and I want to encourage you to keep up the good work that you have been doing in your department.
Thank you so much.
The thought of developing cervical cancer may seem scary, but the good news is that it is preventable and treatable. The key is vaccination and being screened early. Cervical cancer is the second most common cancer in women in Guyana. It is caused by the human papillomavirus, commonly known as HPV. Almost all sexually active people will be infected with HPV at some point in their lives. Therefore, it is important that women aged 21 years or older get screened for cervical cancer. Prioritizing regular pap smears, VIA screenings, or getting an HPV test done is crucial. These tests will aid in detecting precancerous lesions, making it easy to catch cancer in its early stages. These screenings are quick, easy, and free of cost. They are available at various public health facilities in your region. Remember to spread the word and encourage your female friends, mothers, sisters, and daughters to prioritize their health. Early detection is key to successful treatment and a long, healthy life. Together, we can prevent cervical cancer. A message from the Ministry of Health.
Healthcare coverage is now easier and more accessible with the Ministry of Health's voucher program. This initiative offers preventative care to help detect diseases like diabetes, prostate cancer, kidney disease, and cervical cancer before they advance and pose serious, life-threatening risks. It improves the quality of life for all Guyanese at a subsidized cost. The best part? All Guyanese are eligible. Vouchers are available for general health checks, cervical cancer screening, and eye testing and spectacles. So what are you waiting for? Visit any health center in your region to get your voucher because you deserve access to essential health care.
So childhood cancers, when we talk about it, it refers to a group of cancers that affects children, generally from birth to 14 years old. And then there's the other group of what we call young adults or teenagers from 15 to 19-year-old. So generally, childhood cancers is very frequent. It's a rare type of cancer, but still it's kind of frequent. And here in Guyana, we've been noticing a rise in cancers diagnosis, and so I would say it's not as frequent as adult cancers, but we have quite a few cases that we're seeing now. So unfortunately, childhood cancers is not as preventable as adult cancers. So because of the cause of the type of cancers as compared to the adults, in children, it happens mainly when there's a mutation in the DNA. And that can occur either before birth or just after birth, or even during growing and aging for the child. So it's not that we would say, okay, so if we modify our lifestyle, maybe try to look at what we eat as compared to the adults, less exposure to sunlight, less exposure to radiation, and the type of foods that we eat, even that would not help to prevent cancer in children, unfortunately. Maybe a little fever here, some cold, infections, and so on. But when it becomes alarming is if these infections are repetitive, meaning it goes away, comes back without any signs of a flu, as we would say the common flu or cold. If the child has consistent bruises on the skin that, it's unexplained, maybe a bump or a lump in the skin that is growing frequently. If the child is crying out for bone pain, joint pains, and there is no other indication of an infection or so on. If the children have bruising or bleeding when they brush their teeth or so. If they're waking up in the mornings with a sudden headache and a vomiting without upset feeling before. If there's a sudden vision loss, meaning they can't see. Right? These are alarming signs to take note of. So generally, our department, we treat cancers or cases that are already diagnosed. So we generally don't do diagnosis at us. So the cases will have to come from either the health centers or the pediatric department at Georgetown Hospital. So I would advise parents to, if they notice any of the symptoms that I was saying, just refreshing the symptoms, so to speak, sudden swelling of an area in the body, regardless of where it is, and it's growing uncontrollably. The child is complaining of pain. Like I said, they may have a sudden headache that is unexplained, loss of vision. And even there is one that, you can look at the child's pupil, the black part of the eye, and if you notice a white appearance behind, that's also cause for concern because that can be a type of cancer too. So if you notice any one of these symptoms, I don't advise that, you go to anyone else other than your healthcare professional, regardless if it's at the health center, at the nearest hospital, or even at GPHC, the pediatric department, and at least get that child that initial contact. So the doctors will be able to examine and decide how important, how urgent it is, and start the process with the screening and the testing and so on as to arrive at a diagnosis, and then they would refer to us at the oncology department. Childhood cancers have different types, right? As we would say, it affects different parts of the body. There's the hematological part, or the part that just affects the blood. In those cases, we have the leukemias, the lymphomas, right? Then we have the ones that affect the brain and the spinal cord. And then we have what we call the solid tumors, which affect different parts or organs of the body. And I mentioned it in that in that order, just to say of the most frequent ones that are found, which is the leukemias, the lymphomas, the brain tumors, right? So the most frequent ones that we find, or we've been seeing here in Guyana, they have quite a few leukemias, but so in oncology, we've separated the two. The pediatric doctors, they are dealing with mainly the hematological cancer. So we don't see those at our department, which is the oncology department. And at our department, we're dealing with the brain tumors and the solid tumors, which a few of those that we've been seeing frequently are, we've been seeing some medulloblastomas, that's the brain tumor. We've been seeing some retinoblastoma, which is the eye cancers. we've been seeing the Wilms tumor, which affects the kidneys, and a few neuroblastoma. And also we've seen a few sarcomas. There's the Ewing sarcoma and the rhabdomyosarcomas that we've been seeing. Those are the most frequent ones that we've been encountering at our facility. So the encouragement again would be, as we always say, especially in oncology, is early diagnosis saves lives. So that's the main phrase I want to leave with today. And the earlier your diagnosis, best. So as soon as you notice something, don't sit at home and think, oh, it's nothing. For you, it might be nothing, but for us, the medical practitioners, it may be something that could be life, threatening. And even as long as it's diagnosed early, we have the ability to at least try to either cure you or prolong the child's life, which is the most important part.
Thank you for staying tuned with us. I'm Alicia Martin saying goodbye for now.